University of Arizona telemedicine network. And so these are institutions that are all hardwired to each other. And so you can see, well, up there, top right-hand corner, New Mexico, that would be Shiprock. You can see where Flagstaff is, and you can see where the other towns and communities on the reservation are. So these are places that are all linked, hardwired actually to Tucson for this purpose, for the radiology. And in fact, most of the, or many of the X-rays and scans that are being performed anyway here on the Navajo reservation are being transmitted by this teleradiology service and are being interpreted in Tucson. So that the radiology department in Tucson interprets about 120,000 X-rays. So not just from IHS, but they interpret about 120,000 X-rays and scans a year. So next. So in fact what we did, and this slide is out of date, so in May of 2008 we launched this virtual colonoscopy service such that patients get their virtual colonoscopy scans at Fort Defiance or Tuba City, and then the scans are transmitted and those scans get reported the same day. And so again, I don't haze you with a lot of numbers, but in fact now we've now done well over 350 scans in this way. And what is encouraging is that actually the rate of abnormal scans is coming out just about where it should, according to large studies that are being done elsewhere. So the bottom line of doing screening by this approach is that there is some bowel preparation that patients have to do, but in fact it turns out that they're having no problem and don't seem to be minding doing this bowel preparation. They come up, the scan itself takes, you're actually in the machine for like a minute and a half, something like that, and then you go on your way. So there's been no problem with people getting the bowel prep, and it turns out that about 10% or a bit fewer of patients with a virtual colonoscopy done like this have an abnormal virtual colonoscopy scan, and they need to go on and have a colonoscopy. And so, next slide. Let's say a little bit about this. So, you know, I've finished now. Tried to give you some examples from looking at colon cancer, but also to make some more general points about preventive health, not just preventive cancer health. But what we have to do is to get everybody involved in their own health. And I mentioned the importance of family history. You hear all the time about the importance of what you eat and taking some exercise. And it's worth emphasizing over and again that the lifestyle habits that are going to help us prevent cancers, like not smoking and diet and taking some exercise and that sort of, those are beneficial in terms of preventing all of the common making you less likely to get any of the common cancers, and also, of course, they're what are going to make it less likely that you get the other chronic diseases like type 2 diabetes. And I've talked about screening. Next slide. There are a lot of people that are, of course, involved. And we see the remote CTC of the people, our colleagues here on the reservation. So there's a lot of people that get involved in anything like this. What I should say is that we've written a number of grants now, and I'm hopeful that we will get funded not to do this kind of screening. We're not asking for grant money to go out and do experimental kinds of screening. We're asking for grant money to be able to study the results of doing this screening, so that we've written grants that would enable us to hire what we call would be research nurses and patient navigators at different IHS sites that would help us to get patients into the screening and then make sure that we gather all the data afterwards, so we actually answer the question of whether we've come across a way to improve screening and preventive medicine. Next slide. And that's where normally I'm very happy to be, but ecstatic to be here today because it's probably about 115 degrees down there, and So it's very beautiful to be out here. So thank you all very much.
Thank you, Dr. Lance. You've been more than kind, more than generous. And most important, I feel that, you know, as we see the people who've given so much of their time and their skill for the people of the nation, that we're so happy to know that all these resources that you bring, that you're working so hard to continue. And I mean, something we talked about the other day is that, you know, so many times, unfortunately, we're dependent on funding and so on. But I think, again, when you see how much you've been able to do, I hope that it will be rewarded so that we can have you still working and doing what is so important. I'm now going to ask Dr. Lillian Tom Orm to come. Oh, yes, of course, Doctor. Yes.
One thing I said it. Sorry, but I just think it's terribly important that you all know how powerful you can be. So you can get to your congressmen, you can get to your own politicians and representatives here on the nation, and you know, you can go out there. So people like me, congressmen don't take any notice of, because I'm only asking there for more grant money or something. But I think when patients, when you go into your congressional offices and stuff like that, and you say, hey, why is it that people where I live are more likely to die from colon cancer than somebody who lives in Tucson? You know, that can be very embarrassing to congressmen. You know, why is it that there are no gastroenterologists on the Navajo Nation and there are 35 in Tucson? So I just get that political plug in. Sorry.
And that's a great one, because a lot of what we're here about and what we as a small charity is always saying is that we can teach you and we can help you in many ways, but you need to advocate for yourself. And that is probably the most important thing. And thank you for reminding us of that, Doctor, because you're right. You know, we're just another person writing another grant or asking for money. And if they don't see the real people, then they can just think about it as